cervical cancer. The patient said breast cancer, so so many things. The foundation of every cancer is genetic change. Say, genes and be about touch my genes no say DNA as I'm making. The massa mistake na about genes no obi enim nyama bebre to me deba obi wo ha asase so no wabenya sa de no obi wo ha ye de wo ye wo no na he or she was destined to have the cancer because at na change no okay tama ne ma menyem no obi so asase so onam asase so okoye bibi okodi aduane bi na ma change ne by. So what actually causes the change in the gene I bet ultimately lead to cancer no obi enim. But what we know is that there will be a change in the gene and ever manifest as cancer. But then become more characteristics be they say on water and our back one oral contraceptive for over 20 years, 10 years. We started booming over 8 years. When you're 60 years or so, all those people, their chances are higher than the rest of the population. But some people will say, A and I say B, Tina, when you're cancer, and Pempi, no yen to me, and in Pempi, Casse, the Obenya breast cancer no Obenya. The Obenya breast cancer no Obenya. Na, say, Behum in term, and more important. See, I mean, identifying the breast cancer early is more important than what caused it. You can just reduce your risks, but you can't prevent it if you are destined to have it because of the gene change that you've had. And they say, no, we can't know the cause, we don't know what caused it, but once we detect it early, we can do something about it. So our aim is, let's detect it early. If you detect it early, you can treat it like any other disease that we are able to treat.
That's doc.
Okay.
Now, now, what kind of say? You name be or only family, in a family, almost more breast cancer be brain. And I don't know a quick trying new for tuning a hinty a way you need new for tuning on. Does it mean say won't me in your breast cancer now?
Yes. We remove about 99% of breast tissue. Very small breast tissue, but your chances are almost negligible so breast cancer because the cancer never share as you doctor for and your chance of breast cancer is in fact almost zero. But my doctor they mean baby and cancer is 0.00, but so chances are 15%. As I say, would about 0.01% if you do remove both breasts. And I'm sure you know some of the Angelina Jolie.
Jolie.
The grandmother had breast cancer. The mother had breast cancer. She was destined to have breast cancer, and because she had a genetic malformation. And breast tuning now a chance of breast cancer is it's almost negligible. She doesn't have almost no chance of getting breast cancer, but I won't say it's zero, but she's reduced it to almost zero because of breast now and she had a reconstruction and she's leading her life normally.
Hello, I'm Watson.
Okay.
Also.
Doctor, we did ask if Nyame Shroud.
Amen.
My question is usually in the breast cancer, men feel say inform. Can men get breast cancer? Meaning so can want someone. Over to me.
Okay. Yeah, maybe I should maybe that say 1% of all breast cancers it occurs in men. And so nipa 100 or more breast cancer, Bema chances here lower saying but so Bema breast cancer unlike or by to me I can say yare na jare nufu no ho be ma de yi yare na nja nufu nti be ma bia obenya breast cancer yes you nufu nyina afi ho. And that's the main difference. But men to mania breast cancer, just that just 1% of all breast cancers are found in men. But treatment no only be there, it's just the same as for the woman. And the bayama or baby or breast cancer, bema so bayama. The only difference is say maybe or hibeja or mufuno, e be a ban on the janufuno, but bema de ent minja unufun, bema be when breast cancer no. You nufu, but chemo no ni radiotherapy no ni hormone therapy ni there. Obani bema nyina age edrokro.
Oh, yeah, that's it. That's it. Now, that was say breast cancer. A common with blacks, as in other ways, no. Like,
Yeah.
You need to money basana.
Okay. Yeah. Juma ba kwa Dr. Jamo pa wo krom ha. Omo ye investigation. We are all investigating the entire as a breast cancer no. And yes, even more common. Yeah, more aggressive. Oh, yeah, no, a colony in terms of abrofone dear no. Dr. Jamo, work on Dr. Lisa Nyame. Yeah, bomb ama ya hwehwem. So far, you who near man kakaka. We are hoping say with time we will discover more. We are say all more acquired to DNA, RNA extraction. We are studying the black man's breast cancer to understand it more. In a few years, we will understand it better. So see, I started some few differences. Hopefully, as we go on with the studies, we understand it better and better. And Tipana, Dr. Jam on me, and stay a better area because you say the engineer to say, unfortunately, textbooks are using breast cancer in abrofo there, and the treatments in treatment are white. No, I don't know, yesterday my before, but we are discovering say, and going forward, I'm sure in the very, very near future, we'll start developing our own unique drugs that will help our type of breast cancer and not depend on what the white people have been using all these years that we have been told should work for us, but we are discovering it's not working as well for your patients. We are hoping that as we work towards understanding black breast cancer, more solutions will come through.
Oh, thank you so much. Thank you so much. Now, and Shana, the Juventina Ababawi, and to say, Obi, question bo homa on from Brana.
All right, so we'll be on for probably a last question on my part.
Okay.
Say me touchy education for breast cancer and what? Yeah, na detection, I had to say management could not shame you say so high say. But me who say preventative in your money or what I say, oh yeah, as a group it works better than say tobacco oh yeah. To be as an exercise cry and as a be a family no kabum see a bay so be obese be a couple no kabum it works better since say and as so be will be alcoholic addiction in your kikan if a family activity it works better than say one person be a you bet to me to be education na man say this is also what you have to do with or for your wife. Instead of maybe focusing on a man or how or what they will do to detect.
Yeah, I do ask 72 I never can and say patients now almost by hospital or husbands by hospital they tend to do better. They are more compliant, they get more support, they tend to survive the disease better, far better than and I think it's a very, very important suggestion. Yes, ultimately, your health is your personal concern. And maybe you know, baby, say, oh, me kunu say, chemotherapy, no side effects no also don't. My member J. So, and so be cancer. Then you tend to talk to the woman. You tend to, put her aside and tell her that it is her life. Oh, baby, sir. But by and large, those who come with their husbands tend to do very well. So I think next month we are going to do multiple. October we usually is reserved for breast cancer, so we are going to do a lot of education around COVID. Most of our plans are now going to be virtual. We'll go to radio stations in the city, but like you said, we are going to emphasize the need for the husbands to be partaking in the whole process of detecting the disease early. We are also hoping that in the future, like in America, you have a screening program where patients, every woman after a certain age gets a mammogram, a yearly mammogram, which is covered by insurance. I think that is the solution to our problem. If we could get screening done, I'm sure majority of our patients will be detected very early and interventions. If we can only get that done, that can only be done if we get enough screening mammogram setups. Say Kumasi away mammograms Kumasi, Ashanti region is about, we have over 4 or 5 million people in Ashanti region, about 4 million people. More than 50%, so 50% are females, so like 2 million women or females, and there are barely 6 or 7 mammograms in Kumasi and Ashanti region. It is woefully inadequate. Okay, I say yes, screening cry, it will be impossible for, let's say, the 1 million people who are above 40 to have a yearly mammogram. It's not going to work. So we don't do screening mammogram. Very few patients who are educated and can afford bother to even do yearly mammograms, which is so common in America. And yeah, we are hoping that in the future, more mammograms will be available for women to be screened. So we'll also put that in our education this year. Involvement of the husbands and expansion of screening mammographic suits so that we can have all those done. Okay.
That's great. My last question. So, chemotherapy, so about our breast cancer, that's if you know, acquire chemotherapy. Depend unya. If you say nutrient to me to nade. Na say no say bisa basana eka anase bia after chemotherapy no the nutrient no esaba. And last one so after treatment no if you treat nipa for breast cancer na the rate at which breast cancer no esa recur no saying is it every 5 years bia and I say bia nipa yenya like what
okay. The kind chemotherapy chemotherapy there are so many types of chemotherapy. In fact, over New York, America, your patients we are no instance also na ebegina ama chemotherapy A and B and C. Unfortunately, in Ghana no, you were the friend of first line. First line means say obia or breast cancer no, se baby and see a kwanya, and na yet bema one's answer. America no, and this is straightforward. So yeah, in first line no, most of the time, bema nipakono, a drube friend no, a dramais no, it two. And you back at you. Before I ever started, my baby, because I go and cut it off, then so that hair loss won't be too dramatic for the woman. So most of them, then they use the wig. As there, what they say after treatment, chemotherapy, usually we are one every 3 weeks until by and then 3 weeks. Over now, 3 weeks time you come for another dose, and we'll do that about 6 to 8 times. And after your treatment, when you finish the treatment, your hair will grow back, and you can do your styling and everything that you want. A bit to me, almost something to me to kakra. All these side effects, once the chemo is over, which will take about 6 months. Once you finish chemotherapy, the whole course, take about 6 months. You get some of these. In fact, all of these side effects will gradually disappear. Until when you chemo, 1 year time, all these changes would have reversed and she'll be back to herself. We need the woman to cooperate with us for this 6 months of difficulty. So that's our major concern. We discuss this with them thoroughly and start. The other side effects say, we give you drugs preventing nausea and the vomiting. So for most women, you come for chemotherapy, say on Monday. Tuesday, you may feel a little unwell. Wednesday, you should be fine enough to go back to work. So you don't need to stay off work for 3 weeks, no. So the first day of the chemo, usually no symptoms. Second day, you feel a little unwell. Third day, you are good enough to go to work. So that is how it goes here. So by and large, all the side effects. In fact, I think a high empire menstruation, because most of our patients are young. When you start the chemo, their menstruation can stop. Majority of them, menstruation will start back when they finish the chemo. Just a few of them would not have their menses coming back again, but it is so small. It is our number, we are a little careful about. Especially say, Obano on water, now the menses nature hard drink. Fortunately, now in Ghana, in Kumasi, we can help with IVF, so we can harvest the eggs of the woman before starting chemotherapy. Then in case she does not resume menstruation, she can get pregnant using IVF. Your second question is, say, Obia when your breast cancer done, you also more as saying their own breast cancer. And for the first 2 years, every 6 months, you have to come and see us. We'll examine you, we may ask for a mammogram, etc. Because you've had breast cancer before, the changes in your gene may still be present. So you are at a higher risk of coming back with another breast cancer. And it's much on your breast cancer on the left breast, chances of being all right, it was for about 16% more than Obia breast cancer. So we tend to keep an eye on them because we believe that whatever trigger a man cancer first, that trigger is still there. But most of the time, because they've had breast cancer before, we're able to detect the new one far earlier than the one she came with. And to me, any more control over any new cancer that will come than what she came with in the first place. So your chances of getting another cancer or it coming back is higher. Another thing that determines that is stage I would buy, say cancer I would buy in term and one buy in term. One fan buy in term, or chances to cry much higher. Say than Obia or the bar hospital in term started treatment in term. And I'm sure that most of us we've seen pictures of breast cancer. I'll be no for na kesi a crow kesi but down there. This type the chances are very high. And that type is those who came late, very late. We tend to have a majority of them, but by the grace of God, and then we are moving towards Jaria and called in the name Ebebre. And in the near future, our presentation about form even more. Naya Ben, New York, Kakaka.
Okay, that's my question.
What's some patch up, doctor? If I make my
Yeah,
yo,
Doctor,
yo, yeah, that's the power. Addition, our dear, I'm with the end, there's a suggestion, Kakra. If I show, say, okay, in crass, no. Now, a year be by a May, 1 minute deep, and can't come with Nicono, no man, no man, oh. When your education be just a primitive idea, who a do the crowd will enough for my no the court, Madam Ho said, Nana, you for Honey, Madam the man drew a man a pie. Into no, they were back, confounded another card Americano. For when you're a cardiac card back on foundation near my arcade. Let us say, oh, let's say, couldn't probably brew in class here now. My suggestion is that no, Miss Sano. Yeah, a brand now, Kwame and Cromade, a 9th education, master education, so Bibisa, what my and in school no. Over when ya the card Barbie Siho, Obiaran share view, Obiaran share view, and this year, and Cromada Roma, Obiaran share view. Now you're 20 months, a mana, a mammy and another uncle school no, not an adjo, near year teacher for be near church or my dear niece, near Chero, it's a nice school, near Chero at Chero. And ya can cancer, Mamma, Uncle School's wrote me Chero, no Uncle Sandy. Margaret Pomaus and Margaret upon not which on the camera. So, and he come my best friend said, Monson to a buying and Nanka one primitive ideas, one more educated in me and no money, dear mammy, no near, one more crash and said, yeah, almost so neither bow almost so, because what can one tears here at the end of it is diabo. Oh, yeah, is it diabo? You know, for when I will be now going to do and what will be and what you say now and send the breed. And see, a honor Asian, I mean, I'm over to my young baby. I'm almost on education, be a bit me. I'm almost any bomb who says, oh, then you be a bonnier, be a malama, some name, a Yarian or Senate, from a chalk. Coming from a suggestion of the gasset.
I don't maybe some question very quick.
Okay.
Okay, quick one.
Ajo, breast cancer no. Is a came on me fan say abrofudro. Yeah, what be bidro so I timi esa breast cancer na.
Say there be obia to me find a drone. Ekeka, but ye who back one yeah approve Juma and unfortunately no there be answer be anyhow. I mean they don't have obia find a damn base. Nkofo just about radio so now, but we advise against that because you know patients in the call now maybe a pompo can abon no for no the baby draw yes na pompo ya pai na kronewu yes or be now say cancer na or but now if just say now ba no nya cancer pompo can abon no for cancer ankasa there so far nya baby draw a two cancer I say so far we are yet to get one, but I mean we are open to research and suggestions and see.
Dr. Pacho, maybe some question back.
Okay, my last one now.
Yo, Doctor, me that's must papa na Madam Fubinya cancer. Na ohwe breast almost say na adwano nafs no wo ne motom. And our doctors in a year, omo surgery ye e wo kolebu. Omo ye no ancha after say was as affecting ovaries no into nya so nya ovarian cancer and no so omo yi sad that time no knowledge no mo yi ne yemo ayi no nyina ancha after the almost akutwa breast no into omo twa breast no in fact any best 6 months akrana odi wi into this case no cancer no na spread there what they call too late and now said ebra mugusu sano because you see now we can be say unya breast cancer chances of getting another breast cancer the other one also high and no net is and say what really happens until a free her ne call her na last minute we
okay Many year as some who can see it.
You want the number again?
Obi bana or breast cancer. There back one who hear pa ne say. Yebeye and Shemu, I say, ya no, I want to know no and I say, I treco baby.
So then when they
It's no,
them up, I should just give them
I
this.
the X-ray. You try to X-ray,
No,
you
it's
try
a
to
different guy.
scan.
Oh, you ready?
Hello.
Another person.
Kwame, patch me to line on my wife. I'm so ready. Kwame ready.
Yeah.
MP, no, yeah, emu ye and shake me ye say I no atreko baby and entreko and pimpin yare no atreko baby yen twa onufu no so yare no atreko baby yen twa onufu no because o twa onufu for no fan so
It might be the same person who picked them up.
Oh God, Congrats.
Okay. Watch out.
Sir, ebeya sa ne mai ensi nintino oba yebeya CT scan CT scan on my hu enema no papa ma yetumi hu wa krawa ne mu ye ma saya ne bia ko hye baby kra na ye hu enti and the investigations na ye ehwe say yare no atreko baby no is far better than in the past. In the past, no, they did very limited investigations. Enti obu ha yare no all balance yare no aspected that. Enti aspected that now for surgery na boa ni pa ho. That baba na say so man more chemotherapy. Yes, untumi ntu yare na say no for no yetwa especially say yehwe na enko bibia na ni twa no bema yare na ase etu dia ye be so be koye nhwemu ni say yare no atreko baby dia ye ntwa onufo no tete no de cancer nkwa de ombetwa onufo because na nimdia no ne CT scan na any Ghana hasa it mean so say treatment ni mu na no ebia na chemo na omde ma no yare na ma mere won chemo no ebia na amfa papa enti I say o man keep chemo there but yare no so eda so ekonanim some kind of chemo no different types enti ya ma ba ko mienu a we assess to see if you are responding and I say unresponding so unresponding and assessment chemo no first na and so all this may have played a role in the unfortunate woman no there no ebia na yare no all back hospital na yare no there ekonanim deda and a doctor for no mo ehu enti na mo course ko ye surgery man no ana say chemo no na enye papa sa ne me nyina ana say yare na so odin pa eno so to me see sa
Okay.
That's
Super. Na we dey edu ye be my dog am some 1 minute review be answer na ye we na be just some quick review summary.
Okay. Enti the American nyina ne say ye hwe cancer eye emma nyina breast cancer na ye de edikan there ya wo ho ne say nufo no so wo nipa dua no wa bonten enti u de bia wani tia no nufo yi enti sen ba mu na wa mfa mba ntama ya mpempi no ha adwen breast cancer yetumi sa emane ye yesa ya yare no emane ye Ghana ha nyina yetumi sa ya yare no but say betumi asa ejina disease no yare no stage a obabe pie hospital say yare no call nanim enter nko baby anu no sande yetumi sa yare mane ye but say o the bad later and doctor phone to be match then a chese when your breast cancer inside bia e be si onufun inside bia yen ka say ni nyina breast cancer there by we be here say uhu inside because wa onufun na wa onufun ade bia uhu onufun no inside ba wa obehu emfa ho inside kro and e mane how say o call hospital a e be ka say any cancer e no ye sin obetena fia e chire e be ba na e cancer akonanim bebebre say America no onufun wa abonten enti insan ba say utumi hu anya bibia e be call so onu fum na cancer enti ensusuma o ye mo nhwe uhu bibi ben hospital na doctor nhwe cancer abantam ntino o chances are very high no matter what size so ahwe ukunu no ma say enye cancer e de nyankopon ase na ukọ baby enye cancer bia na betwa unufo baby o de bantama mpempi no ye ntwa unufo yare na ke na be ye fi unufo nim bampo say betwa unufo a ye wo reconstruction na yetumi ye unufo no efoforo e de ma se na be ya body image no ne o confidence no ko be bia chemotherapy say who hear so much chemotherapy side effects no they are all reversible once you finish the chemotherapy. Your hair, your nails, your blood levels, everything will come back to normal. And your best breast cancer it to me sa emani but the here can see and say Odwaba hospital and
Oh, Doc, thank you so much. Thank you so much. Thank you so much. Say, what they say at the abre say obade I was say wo no for no send yet here. Na say so bia bebam bia any change bia na say what about hospital. Na me ensure pa na bibia wo ba hwe bia na me ensure mu ana ejuma mo so mo ye Ghana Dr. John Enewo. I mean, Niamoya to improve breast cancer treatment in Ghana. No, really good. Namisha yenso the I mean, yes, bis mayano. Ya be the aboma mojumano aye easier. I mention one said Dr. Ajima Waswa or Bema closing prayer no. Nanka ya de abawe.
Pacho mo me mompae. Ere ja osre da wasi aduma da wadi adum yen. If you say nimdia na wodi amaye no. Esenki tue sika kese pa na ya saka. So da Roma wodi ache yen kwa. Duefo mpanimfo a omdi enimu no omdi sa ahihye bre wonyam yesro hirawo. Ye wahwe bia wonyam yehye wana. Ma won enya yokudro honhom no nko wanim eni atu ho ache. Nese ne omoboa no emoa no nko nanim. Yesro ye de ma wo Ghana hye wonsa. Emma Ghana fo ma wo America ha ye de ho hye wonsa. Yare ya nyame yesro bo ho ban. If you say wutumi ade nyina ye ye do was so etie we Yesu Kristo di monti. Amen.
Amen. Amen. And see health and 24 say announcement go home na yedaba na Dr. Jan say bibi kan before you be kono.
Oh, Davey, I'm glad you're successful. At least we had about 40-something people on there. Yeah. So my kind of money, you have me. So opportunity, but I want to get a different person for another doctor. Now there's a change. So I'm glad you're the my. We want to make breast cancer history. So no candy, we started sequencing, we're trying to find out what actually caused this. And then the moon I say, why? Okay.
God bless.
Me quick I will sign off. Yeah.
That's the Nyame Shramo, Doctor. Dr. Che.
Oh, that's if yeah. Okay.
All right. And a doctor
Yo. Okay. Bye from Kumasi for now.
Amen.
Okay. Bye.
You and you and Mama Mispo.
Amen.
And Ubehu be an unwife, COVID. I'm often not their bread, no bronze for son. I think I'm yes.